Lesson number 17, Defined Contribution Plans Overview. Hi, it's Mike. How are you doing today? I hope you're doing well. Thanks for coming by. It's good to see you again. Today's lesson will be a very quick one. I wanted to go over health plans that are not really health plans, and one of those that fits into that category quite nicely is a defined contribution health plan. A defined contribution health plan is not really a health plan. It's an approach to providing health care services for employees in a company. That's basically what it is. It's not a textbook definition, but to keep things simple and to keep it from getting, too confusing. That's the basic idea. What companies are doing to combat the ever-rising costs of healthcare is to set up plans that are called defined contribution health plans. Defined contribution health plans are simply this. Once again, this is not an absolute textbook definition, but it will be good enough for class today. Companies want to do two things. They, one, want to hire the best and brightest, of course. But the second thing they want to do, in order to hire the best and brightest, they have to offer benefit plans that will attract those people. What the current philosophy is, especially post Affordable Care Act, companies want to use defined contribution health plans as a basic healthcare strategy to help them save money, attract the best and brightest, and do it in such a way that it will be far less cumbersome in an administrative sense. When companies want to save money, the first thing they do is, of course, cut benefits. Defined contribution health plans do exactly that. That was why they're created, in fact. Defined contribution health plans are really picking up steam here in the United States. They're really becoming popular, and many huge corporations are using them. What is a defined contribution health plan? Once again, let's keep the definition very simple. Rather than paying the cost to provide group health benefits to a group of employees, what businesses are doing is they're going to literally give their employees money to choose their own health care plan. That's basically what it is. That's at a nutshell level of understanding. Typically, employees in the past, you got a plan from your employer or a choice of plans, and you looked at it and you said, well, I'll pick, out of A, B, or C, I'll pick plan B. Well, in business, they're moving away from that model. What it looks like and what it looks like the future is going to hold for employee health care benefits is that they're going to give you, your boss, your employer, is going to give you, like, say, $350 a month or $500 a month. And they're not going to tell you how to spend it. What they're just going to do is give you a series of choices, and you choose to opt in and you can choose to opt out of their choices. What it does is, what this approach will do is that it will give employers enormous savings, because with group health plans you pay huge amounts of money because you're insuring people who, one, aren't sick. Two, you're incurring enormous losses, dollar for dollar for those people who are sick. Defined contribution health plans answer both those questions. You give somebody some money, you give the employee some money, and you say, look, here's your money. Now you can go and make your choice. And that's basically the way it's set up. Employees will be responsible for selecting an individual health insurance plan and making payments out of their own finances. Now, of course, the tax ramifications, being what they are, if you get, say, $500 from your employer, you'll be paying tax on that money. So remember, this will be literal income. I don't know exactly what future for defined contribution health plans, how they're exactly going to work out the tax ramifications for the employees, or if there will be anything worked out at all. But you're going to get this $5,000 a year. And what will happen is that you'll basically choose your own plan. Some people will choose a plan, and some people will naturally keep the money. That's where the problem comes in. But for employers, defined contribution health plans are going to make them a fortune. Now they can direct money at people and just say, look, here's your $500 a month, $6,000 a year, and that's it. That's basically what defined contribution health plans are. In future lessons, we'll go over more in-depth topics associated with defined contribution health plans, but I wanted you to be familiar with them and understand at a very basic level what they mean. Because chances are, if you have a job, you will definitely see a defined contribution health plan very, very soon. They're all over the place and they're spreading like weeds in the field. So get ready for this one because it's definitely coming. It's already here, but it's going to be far, far more widespread as time goes along. That concludes my lesson for today. If you've liked what you've heard so far, please subscribe, like, and comment. As always, thank you for your time. Take care and be well.